By the time I got to the emergency room, my ejection fracture had gone down to 22, which, I was in heart failure.
Wow.
Bad. By the next morning, as they were sending me in to get an MRI done and about to go in for a heart cath, my ejection fracture was down to 12. So I was...
You were
I was nose diving and sort of at the 1 yard line of, where you need to be.
Hi, welcome back to the channel. My name is Dr. Aziz, a physician based in the UK. So you may remember Triple H suffered a cardiac event a few months ago. He recently gave a candid interview and provided further details of what happened exactly. I'll give you my thoughts as we analyze what he said. I'll also give my thoughts as to what I think really happened and was there any connection with his quite obvious history of steroid and growth hormone use and the cardiac issues he mentions here.
I was in Florida when towards the end of that, I started feeling really run down. I thought I had some COVID, which, I had before. I was vaccinated twice and had a run of COVID without symptoms, but I was beginning to think that I was having shortness of breath and, everything else. I went and got tested for COVID. I didn't have it, but I had a viral pneumonia.
Now, shortness of breath can be from a number of different causes, from anxiety to lung infections to your heart struggling to deliver oxygen adequately to the rest of the body. In this case, Triple H was initially diagnosed with viral pneumonia. Pneumonia is a lung infection, which can be serious. But this wasn't the end for Triple H. Things, in fact, worsened.
My lungs were inflamed, and as the next couple of days went on, when I got home, it got increasingly worse. And my wife saw some blood and stuff that I was coughing up.
Now, coughing up blood is generally not a good sign, but it can be from a number of causes, from the actual retching to a serious chest infection to a blood clot in the lungs, but it can also manifest in heart failure, where you can bring up pink, frothy sputum.
And went and got checked, and it was coming from the viral pneumonia, but I had fluid in my lungs. I had some fluid around my heart.
So basically what was happening here was fluid accumulation in the lungs and around the heart. Now, as we'll see, Triple H was actually going into heart failure, which basically means the heart is not able to pump blood adequately. There is then back pressure onto the lungs, fluid accumulates there, something that we call pulmonary edema, and this causes breathing difficulties.
So they followed up on it, did an EKG and echo and everything.
Now, an EKG, or ECG as we call it here in the UK, echocardiogram, are the basic investigations from a cardiological perspective. An ECG is an electrical tracing of the heart. There is continuous electrical activity in our hearts throughout our lives, but this activity can change depending on what is going on. A heart attack will give a particular reading, for example, as will an enlarged heart or irregular heartbeats. An echocardiogram is basically an ultrasound of the heart and provides information about the structure and function of the heart, including whether it is enlarged, as can occur in heart failure, and how effectively the heart is functioning.
Basically, the way your heart pumps out, 55 to 60% of your ejection fracture is a good number. I was at 30.
So just want to say at this point, Triple H really demonstrates good knowledge, rehearsed or otherwise, of the cardiovascular system. So anyway, blood comes into the right side of the heart, squeezed out to the lungs, then back to the left side of the heart, and then squeezed to the rest of the body. Now, the ejection fraction is a measure of how well the heart squeezes out the blood relative to how well the heart fills up with blood. And Triple H is correct. A good measure is 55 to 60%. A lower number means the heart is struggling, and given Triple H's ejection fraction was now down to the 30s, he was definitely in heart failure.
That was just kind of following this medical stuff up the line of didn't like the way my lungs were inflamed, even though I had pneumonia. It was kind of something more going on here. So by the time I got to the emergency room, my ejection fracture had gone down to 22, which...
So his ejection fraction was going down pretty rapidly, and if he wasn't receiving medical attention by this point, he would have certainly died. Something sadly that did occur with Ultimate Warrior and Randy Savage, you may remember.
I was in heart failure.
Wow.
Bad. By the next morning, as they figured that out, that evening, by the next morning, as they were sending me in to get an MRI done and about to go in for a heart cath, my ejection fracture was down to 12.
So it's becoming very severe now, down to 12%. This is pretty critical. Minimal oxygen is getting to vital organs such as the brain.
When they got inside, I basically genetically had a 99% blockage in my left anterior descending artery, which is...
Now, this is where I'm starting to suspect the truthfulness of what Triple H is saying. How they all love to throw genetic cause in there. We've seen this from Warrior to Ziz to now Triple H. Yes, your genetics can determine many things, including cholesterol levels. There is something called familial hypercholesteremia, which can contribute to blockages of your heart vessels. But a 99% blockage purely down to genetics? That's a new one, Levesque. I'm not doubting the blockage part. In theory, that makes sense. The heart is a muscle that needs its own blood supply. If it is cut off, then it will struggle to meet the demands of the body. What I am doubting is the suggestion by Triple H that this was 99% attributable to genetics. Now, given Triple H went to the cath lab, short for cardiac catheterization laboratory, it's likely that they put a stent in. He also mentioned in the following clip that he won't wrestle again, and part of the reason is that a defibrillator or ICD has been put in his heart.
Well, for me, as far as in-ring, which I get a lot, I'm done.
You'll never fight.
I won't. No, I would never wrestle again. First of all, I have a defibrillator in my chest, which, probably not a good idea for me to get zapped on live TV. Right?
Now, what are my thoughts? I think most of what Triple H is saying is true. It certainly makes sense physiologically, and he is pretty clued up when he talks about this stuff. As someone so high up in the business with so many wellness programs and wrestlers generally dropping like flies over the decades, he either buried his head in the sand and wasn't investigated previously, or he had some idea but continued with the steroids, growth hormone, and so forth. Regardless, there is clearly heart failure going on here, a key part of which is an enlarged heart, something we've seen on many other autopsies on this channel, from the Warrior to Randy Savage to British Bulldog to Ziz and so forth. We know this can be consequence of steroid and growth hormone abuse, and this is a part Triple H completely omits out of this discussion, for obvious reasons I guess on his part and that of WWE. I do think Triple H is smart though, as were the people around him. If you think back to Warrior's situation and Randy Savage, both of their health in the final couple of days were neglected. Both of them were feeling unwell, but neither were taken to the hospital, even though both had told their wives they were feeling sick. In Triple H's case, clearly they sought medical help, and several times. If they hadn't, he would have certainly died. He is also sensible in not going back to wrestling, both from a cardiac perspective, his heart is likely to give out if he exerts himself to that level again, and from the fact that in a contact sport such as wrestling he can damage the ICD. Finally, it is not common to have an ICD or defibrillator fitted after a heart attack or myocardial infarction. This is more common in heart failure or enlarged heart with scarred tissue and increased risk of sudden cardiac arrest. Again, this points away from the fact that this was a bona fide heart attack, but more in keeping with heart failure and a struggling enlarged heart in general. I'll link the autopsies of other less fortunate wrestlers and celebrities who died from heart failure after not receiving medical attention in time here, so be sure to watch them. Anyway, what are your thoughts regarding Triple H and ongoing issues with athletes who use illegal substances and the cardiac issues? Be sure to hit the like and subscribe button. Any comments or suggestions, please do let me know below.